Nigerian resident doctors have commenced a nationwide strike as coronavirus continues to spread throughout the country. The National Association of Resident Doctors announced that the strike will be indefinite. Those treating COVID-19 patients will stay on the job, but the association has given the government 2 weeks to meet the demand, or else they will join the strike. Resident doctors who have graduated from medical school and training as specialist consultants are critical to the healthcare sector as they dominate emergency wards in its hospitals. The resident doctors are seeking a COVID-19 supplementary pay in addition to life insurance for doctors and more funds in the federal budget for their training, amongst other demands. This is on the front burner. There are two sides to a coin. The second side, Tundun, is this morning, is the fact that the Labour and Productivity Minister has come out to say it's betrayal because they agreed with the doctors to be able to pay them this COVID-19 allowance, and they were just waiting to get through the payment process before the doctors went on strike. The doctors are saying, far from it. We know when we started this journey. We know when we started this battle. But isn't it sad that for the second time in the lifetime of this crisis, COVID-19 crisis, the first time the doctors threatened to go on strike, the second time they've actually made good their promise? What do you think about this, Tundun?
I think it's absolutely awful. And that concession that the COVID-19 doctors will not join the strike for 2 weeks is not the most generous of concessions. What happens now to the general Nigerian public if they get in an accident, for example, and so many other medical emergencies that could occur? This is really disheartening. I recall the Residents Association singling out the speaker, Femi Gbajabiamila, for his sincerity, essentially saying that other government agencies and other government agents were not sincere, which is what you were alluding to earlier. But I would have hoped that this could have been ironed out in a manner that sort of honors the vocation, the calling of doctors, so that they don't down tools at this kind of critical time.
Yeah, I think it's a very embarrassing development, considering the fact that the strike has come at a time when the country faces a public health crisis, not just with COVID-19, but also other ailments that we've been told are not being properly addressed because of the anxiety of both public health workers and also those in the private sector. Now, it's also, again, very embarrassing that this has happened, considering the fact that the Resident Doctors Association of Nigeria, they served notice of strike. They give a 14-day notice. Now, what happened? Now, for 14 days, the relevant authorities, apparently, from what we know, did not make any effort to engage them. So when yesterday, the Minister of Health and at the briefing was now saying, well, they are already reaching out to the resident doctors, and they are appealing to them to call off the strike. My concern was, after 14 days, after the fact, the resident doctors held a meeting on Sunday, at which they decided to take a decision to push ahead. And they said that the strike would be total and effective, even if they said, you know, doctors who are involved with COVID-19 operations may not be a part of it. Again, what we have seen here is the inability of persons who have been given the responsibility to manage industrial relations, to do it effectively. And this particular Minister of Labour and Employment has been very controversial. This is not the first time he will get into a spat.
He said not doctors. That's what he said.
Yes, that he will get into a spat, either with doctors or with other labor groups. We hope that, you know, this will be resolved very quickly. The issues are not just allowances. They are very serious issues. One of the issues involves the sacking of 26 resident doctors at the Jos University Teaching Hospital. They're saying that those doctors should be reinstated. I mean, it shouldn't take forever to do a review of you know, the expulsion or the sacking or disengagement of those 26 resident doctors. They're talking about protective personal equipment for health workers on the front line. Now, the minister says that has been resolved. If that has been resolved, they will no longer bring it up. They are also now talking about allowances and arrears, and then also training for resident doctors. So those issues, all of those issues will have to be addressed, you know, comprehensively. And I do not think that the right approach is either for the Ministry of Health or the Ministry of Labour to cherry pick as to what is convenient for them.
Just as a sidebar note, that same minister, the Minister of Health, was the one that couldn't say specifically the allowances the doctors were getting as hazard allowance for fighting COVID-19 while he was talking to Honorable Gbajabiamila at the House.
Well, but he has since reversed himself, and there's been more talk about payment of hazard allowance and an insurance package for health workers on the front line. Now, what constitutes that insurance package, nobody knows, because the president of the NMA, you'll recall, was here, and he was saying, well, they are just talking about it. We don't know what it contains and who is in charge of it. So we need greater clarity and communication and cooperation.
Talk is cheap, action is priceless. The chairman of the All Progressive Congress, Adams Oshiomhole, has offered an explanation for the disqualification of Godwin Obaseki of Edo State from the state party primary election ahead of September's governorship election. According to him, there was no way APC could have considered bending its own rules in order to give the governor the right of first refusal as he seeks a second term in office. Oshiomhole, who was fielding questions from State House reporters in Abuja after a meeting with Chief of Staff to the President, Professor Ibrahim Gambari, declared that APC was not a party of big men, but an organization where the same rule applies to all, irrespective of status. The party had last weekend disqualified the governor and two others from contesting the primary scheduled for June 22nd. However, Governor Obaseki had openly been hobnobbing with the main opposition, People's Democratic Party, since his disqualification, and barring any last-minute change in his plans, he, alongside his deputy, Philip Shuaibu, and other top government officials are expected to formalize their defection this week. Reasons, reasons, reasons.
Well, I mean, I think that Comrade Adams Oshiomhole can afford to sound triumphant, even if he didn't use those words directly. You will recall that the governor of Edo State was reported as planning to meet with President Buhari for him to know the way forward. Well, it will be difficult, I guess, for the president to dictate to the party at the state level. Now, Adams Oshiomhole and other members of the National Working Committee, they met with the Chief of Staff yesterday to present their own side. And they were saying the party is a party of rules and that the rules cannot be violated in order to accommodate anybody. But those are not the key issues that we see in the public domain. It's about qualification. It's about, you know, whether HSC certificate
what were the rules?
or NYSC certificate.
And typos.
You know, yes.
And those rules were in abeyance to the Constitution. Because, like you said rightly, Dr. Abati, the Constitution asks for evidence of attendance.
Yeah, Section 177.
Yeah,
yes.
And the reasons at which Obaseki was told not to run were not substantiated as evidence of attendance.
Well, I don't know, but the latest that we hear is that definitely maybe before the end of this week, according to the PDP chairman in Edo State, that you may find Obaseki and his supporters moving over to the PDP. What then happens thereafter? Will he be given a waiver by the PDP? Will he be able to stand up fully to the APC? Remains, for now, in the realm of conjecture.
All right. That's all we can take on headline news today. Thank you so much, Tundun. Thank you so much, Dr. Abati, for that. When we return, we'll have the trio of Rotus, Odiri, Michael Wilson, and Aaron Akerjola to give us updates of our African Business Report and COVID-19. Stay with us.
Welcome back to the morning show here on Arise News. Joining us now is our very dependable Rotus Odiri to give us Africa Business Update. Good morning, Rotus. Over to you.
Good morning, Doctor. Good morning, Doctor. Good morning, Tundun. Good morning, Rufai. The discussion today is on the Lagos State government's announcement that there will be a 90-day moratorium on loans, on payments on loans received from the Lagos State Employment Trust Fund. This is for MSMEs, the micro, small, medium enterprise. As you can see there in the Lagos State tweets, Lagos State Governor Babajide Sanwo-Olu approved a 3-month moratorium to members of the micro, small, medium enterprise who have borrowed from the Lagos State Employment Trust Fund as part of concessions to cushion the effect of COVID-19 pandemic on their businesses. The moratorium will serve as a palliative, encourage entrepreneurship, and sustain the confidence of small-scale industrialists and MSMEs in the state. I want us to focus on that particular quote, though, within the context of this particular pandemic. Again, the moratorium will serve as a palliative, encourage entrepreneurship, and sustain the confidence of small-scale industrialists. Within the context of what's been going on here, this is just a 3-month reprieve on payments on the loans. And then these are small loans. It's important that for the Lagos State government to get a handle on what businesses are looking for, that they seek data. And it's very fortunate that the Faith Foundation and budgets have come together in order to do a survey that was just completed. And that survey spoke specifically to MSMEs and the challenges that we're facing. So let's take a look at that now. So it was a collaboration that was done between, this is the impact of COVID-19 on Nigerian MSMEs. This is specifically, I mean, this is just fantastic that they just happened to bring this out when Lagos State government announced this. So if we take a look at a summary of what this essentially was saying, this was recorded responses from 1,943 MSMEs. 94% of them have a negative impact from COVID-19. Now, this is important in cash flows. 13% have enough cash flow. We need to go back. Let's take a step back to that previous summary. 13% have enough cash flow to last 1 to 3 months. 33% have enough to last just 1 to 4 weeks. 27% have enough cash flows to just last for just 1 week. 82% are likely to lay off 1 to 5 employees. On the positive side, though, 50% are able to identify opportunities during pandemics. Now, let's skip next and take a look at the source of their cash flows to the right. To the left is the available cash flows survey that we just took a look at in percentages as to how long each business can last. But importantly, to the right, if you look there, 53.7% of the MSMEs surveyed, their source of cash flow is their own reserves. 13.8% is loans, of which the Lagos State government is making an announcement now that they can have a reprieve for 3 months from the Lagos State Employment Trust Fund. And then just 9.7% from family and friends. Now, if you look at the question of support on the next time, they ask them key areas of support. Are you presently receiving any form of business support? 94.2% said no. Again, this was conducted in May. This is palliatives and stimulus measures had already been announced since March. Only 5.8% of them say that, yes, they have received assistance. Now, again, to government support, the issue of support, where they ask them a further question as to what kind of supports how would you like government to support you at this time? Look at that. 89.4% of them said they want funding. They want money. 33% say access to market, 32% said reduce loan interest, 30% want electricity, alternative energy, 23.5% want internet and data, 22.5% tax rebates and holidays. But 89.4% want funding. It is money that they're essentially looking for. And then on virtual services, there was a very interesting question they asked here. Are you able to provide your product or service virtually? We've talked about the new normal, video conferencing, Zoom calls, being able to, distance ourselves from customers. 76.4% said no, they're not. These are still businesses that have to conduct themselves face-to-face with customers. So there's going to have to be areas of, switching here. But as far as this new normal, for a lot of MSMEs, that's not the case here. And then this is another important question they asked them on business survival. 47% of them, they asked them, do you think you will survive this pandemic, your business? 47% said yes. 30% said no. 22.8% said they're not sure. You can look at this two ways. You can either say it's positive that a majority of them, 47% say yes, they will survive. Although if you combine the other two, that's 52.8% that either say they will not survive or they are not sure. So, you take this into context. It's good that the Faith Foundation and budget put this together, but these are the type of surveys that states need to conduct on a regular basis. Because as you can see, while the effort is commendable from the Lagos State government that a 3-month moratorium is helpful, what these businesses really need is not a break from paying off loans. They need funding. And just to point out, the Central Bank of Nigeria, their moratorium on loans to small businesses and households was for 1 year. So there's also a question of whether or not 90 days from the Lagos State government for the LSTACF is even long enough, where we don't know how long this pandemic is going to last. And we don't know how much more assistance businesses are going to need. Next up is this economic sustainability report. I wanted to get to this yesterday, but we didn't. This was the sustainability committee that was set up by President Buhari on March the 30th. Vice President Osibanjo presented the findings on Thursday, the 11th. The findings, 39.4 million people may be jobless. It's just a projection by the end of 2020. Unemployment may rise to 33.6%. If you, at that figure though, I think it's more 40% because as of Q3 2018, 20%, we had an unemployment rate of 20% with exactly 20 million Nigerians out of work. So if almost 40 million are going to be out of work by the end of 2020, that doubles the rate from 20% to 40%. Anyway, minor thing there. And then millions could be pushed into extreme poverty. And then finally, GDP may contract between 4.4% and 8.9%. The next thing is, okay, the president has set up this committee. Vice President Osibanjo has presented his findings. What's next? And that's the update.
Let me just make a few comments. I think on the Lagos State Employment Trust Fund and the plan to offer a moratorium to MSMEs and the tech ecosystem in Lagos. What is new? Because this same announcement was made in April, and now in May we're getting the same announcement. But what I would like really to know is how big is the size of the support that has been provided? As of 2017, we were told that that Employment Trust Fund had given out loans of about 4.5 billion to about 5,000 businesses. Now, what is the size of penetration at this time? Now, as for the report by Budget and Faith Foundation, I think what is important is that, yes, as you said, this surveys should be done. But what do we do with those surveys? Exactly. I hope that there will be an interface between Budget and Faith Foundation and maybe the Economic Advisory Group, the Economic Sustainability Committee, and also the Presidential Task Force on COVID-19 that is now talking about a 3-year COVID-19 response plan. Are there things that they can take from that report in terms of short-term, medium-term, and long-term interventions? Otherwise, you just have this beautiful report with very instructive indications, and nobody will do anything about it.
Right. And the need for funding is self-evident, so it needs to be decided where that funding is going to come from. Let's hope we don't have that automatic and frankly lazy recourse to borrowing. Let's hope that more creative ways can be found to fund these businesses. It's really quite, anxiety fueling, the idea that so many businesses are thinking that they're going to go out of business at this point.
Thank you so much for that, Tundun. And in 30 seconds, Rotus, what I want to talk about are people that are going to lose their jobs. You said a sizable, over 82% of SMEs said they will lay off between 1 to 5 people. How can we buffer that? In the UK, they have the follow, where you go out there and the follow takes over the paying salary of the people.
80% of salaries.
80% of salaries. So let's watch that number.
Exactly.
We need data to be able to do that, and we don't have the data.
And now for more of a global business update, we go to London and talk to Michael Wilson. Good morning, Mr. Wilson.
Good morning. Stocks in Asia up about, good morning, everybody, up about 3%. This is after the Fed made another announcement about buying back corporate debt. This time, this was about specific companies. I'll come on to that. And also, the Bank of Japan has issued an increase in its rescue program to 110 trillion yen. Now, how much is that? Well, it's 30% more than it was, which means it's actually quite a lot. Let me just take you back in time briefly through the markets as they actually ran yesterday. So it was a bit of a negative day as far as Europe was concerned to start off. And that was basically a hangover from the week before, where we'd got all those prognostications about economies shrinking and all the rest of it from the World Bank and so on. But remember, it was only about, a week ago that the major indices actually were all up, including Britain, were all up in sort of multi-month highs. And governments, of course, have been unwinding their lockdown policies, and equities enjoyed a rally until early June. But now everything's changed because the reopening of of various economies has triggered a rise in the number of new COVID-19 cases, and governments now are having to get used to the idea that a rise in the infection rate is going to be a byproduct of lifting certain restrictions. And then the Federal Reserve announced yet another rescue plan. This was to buy individual corporate bonds. In other words, to buy bad debt from companies and buy good debt as well from companies, specific companies. And this was actually welcomed by traders because it was only last week that the Fed had said that the US economy would contract by 6.5% this year. The Fed has also recently tweaked its Main Street lending program so it can issue more loans to people. So basically, everybody was relatively happy. And the throwing of money by the Fed at the problem, the Federal Reserve, this is the US bank, the US central bank, continues to boost sentiment. S&P 500 gained over 0.8%, NASDAQ up over 1%. And there's more. The Trump administration has announced late last night that it's considering offering $1 trillion on infrastructures as a way of boosting the economy. Now, I'm not old enough, and neither is anybody I know, and I'm sure you aren't, to remember what happened after the First World War and the Great Depression. But President Roosevelt actually decided to spend money on big infrastructure products. That got America back to work. And everybody was very, very proud of the way that America went back to work. Just before we go to the break, I'm just going to give you a bit on gold. We'll come back to oil after the break, if you like. Gold ended the session slightly down, but it was given assistance as the dollar started to slide as well. Obviously, the gold being priced in dollars, that helps it. But it's been particularly volatile recently because people just don't know where they're going. I'll have more in a couple of minutes.
Mr. Wilson, we're actually skipping the break, so do go right ahead.
Oh, good. Skip ahead then. Right, oil then. BP. Now, here's the announcement. Okay, it's going to cut its dividend. Yeah, we all thought it would. But here's the important thing for everybody around the world. They have cut their assumption of the oil price by $20 a barrel, which means that the average price they think is going to be, the long-term price is going to be about $55 a barrel. Now, that will be a very important calculation, I would imagine, for a major oil company like that to make, but also for producers elsewhere around the world to say, if that's going to be the price, then are we going to have a sustainable oil-based economy, as Nigeria's is, of course, on the basis of that. UK unemployment here. Now, you were talking about a possible 33%. 1 in 3 people being out of work. That's absolutely huge. I mean, we're worried here that the jobless rate is stuck at 3.9%, but it means that 600,000 jobs have been lost since the beginning of May. I was talking to you about Magic Monday yesterday and shopping. People have been allowed to go back and shop for non-essential items. The pictures that you will see on the various news programs around the world will show people queuing outside shops. They certainly did. What did they do when they were inside? Well, they went into a one-way system, and maybe some of them shop. Will they be back later on? Just don't know about that. But that was a decent start, but not, as the pictures suggest, a magnificent one. Footfall was up, but still down on what it ought to be. And finally, let me tell you about Brexit and post-Brexit and EU-UK trade. It looks like there's a spot of optimism coming from that. Remember that these negotiations, because of the life in which we live now, are carried out by phone rather than face-to-face. And I'm sure that a few of you will know there that, trade negotiations are basically like a slow death. That's what it was described by somebody to me the other day. It's a horrible negotiation to have, but it looks as though there might be a bit of optimism on the table. And I know, Dr. Reuben, you wanted to ask a bit about Brexit, didn't you, yesterday?
Yes, yesterday I was going to ask you ahead of the meeting, the virtual meeting that was held yesterday, that what are the likely roadblocks? COVID-19 had slowed down the discussions. Now we're told there will be a new momentum. And the Prime Minister is saying that by July, August, the talks will continue at pace. And by December, there will be a deal in place. But are we really optimistic that there will be a deal? And who will the deal favor? Are we likely to see an extension? Tory MP Daniel Kawazinski is already saying, look, because of the deficit that the UK has with the EU, is more in the interest of the of the EU to have a deal or no deal?
Absolutely. I think that COVID-19 pushes the whole perspective of everything into a very different shape. I think everybody is actually keen for a deal. The key person in this is going to be the German Chancellor, Angela Merkel. She's seeing as being the person who will actually push these negotiations through. There is a much better atmosphere surrounding them. The view is here that we never in the past needed to have the constraints of trade agreements to carry out trade. The UK has always been a mercantile nation. We tend not to look inwards, but we look outwards, and we welcome countries, as you will know, to London to do business, particularly in the city of London and so on. If you remember a certain Prime Minister of the UK, a certain woman called Margaret Thatcher, you'll remember her. She was famous as trying to promote the UK as what she used to describe as a sort of aircraft carrier for business, sitting offshore from continental Europe, but providing the kind of conditions that would allow international manufacturers like Honda, for example, like Nissan. Those days have gone now, but you know they were important 30 or 40 years ago, to actually manufacture here, get a good workforce, and have corporate governance as well, which is something that investors actually like. But the negotiations are going to be very tough. There will be corporate governance. There'll be state aid discussions. Now, watch what's been happening, actually. This is very interesting. France and Germany have both offered state aid to their airlines, to their national airlines. We have not been allowed to do that yet. We may not, but that'll be something to discuss. And also the old one, which is fishing. I mean, it may not sound a lot. We were talking, weren't we, on Friday about fish and chips and everything, but this is very, very important. Our continental waters, our offshore waters are vital to us because we are an island. But I think it does sound a bit more optimistic. I think we will have some sort of agreement by December, maybe even earlier.
Thank you, Mr. Wilson.
Thank you very much, Michael Wilson.
Now for a COVID-19 update, Aaron Akerejada joins us. Good morning, Aaron.
Yeah, good morning, Tundun. Always a pleasure seeing you this morning and looking all beautiful in polka dot this morning, I must say. And good morning, Doctor. And good morning, Rufai. Hi. Let's get straight.
Rufai is just looking at you.
I'm not even looking towards him. I'm not looking towards his direction this morning. I'm all eyes on Tundun today. And let's get straight into the update. And we'll start it off with the numbers. Of course, John Hopkins have been kind to provide us with some of the data. And as of this morning, like we predicted yesterday, we've actually crossed the 8 million mark for number of confirmed cases for COVID-19. 8,035,364 to be exact, with a death toll of 436,918, which is kind of grim. And looking at it, without a doubt, the United States still takes the cake of it. Most of the infections, well over 2 million infections in the United States. But you look at all the places, there are some good news, understanding like the areas like Thailand have not recorded new cases in the last 24 hours, while things are actually spiraling out of control in Mexico, with Mexico passing 150,000 infections as we speak this morning. So you look at that and you say to yourself, while South Korea have only reported 34 new cases in the last 24 hours. But let's look at the graph for COVID-19 and how things are actually just pushing health understanding and health science as it stands, as we understand it right now. Looking at the graphs for the COVID-19, if Director can be kind enough to actually help us there, you can actually see those cases which have crossed well over 1 million. Brazil is inching close to 1 million, while the US is the only country with well over 1 million cases. As a matter of fact, the US has 2 million cases. Brazil is inching closer to 1 million. All right. India also, we've been speaking about how things are actually spiraling out of control, even though they're still easing up restrictions in India. But that's how we actually see it at the moment. Russia, Spain, Italy, and the United Kingdom of all, they're inching closer to the 1 million mark and just below 100,000 at the likes of Singapore, mainland China, where it all started from last December, Japan, Australia. Then below the 10,000 mark, of course, we have the likes of South Korea, New Zealand. Then below the 1,000 mark, Hong Kong, Taiwan, and as you have it there. Moving on to the next graph also, you can actually see the number of infections per day. And this is where the World Health Organization has been issuing that and telling world leaders and the entire world that they need to be careful. And as it stands right now, when we start witnessing well over 100,000 cases every day, you can see from the 21st of January, the number of cases to yesterday, the 15th of June, the new cases, we had 122,035 new cases of COVID-19 in the world. So it's really, really sad. But moving on from there, since we're talking about the world, now looking at surfaces, they've actually brought out how coronavirus and COVID-19, the virus, how it lasts, and the gestation period, the lifespan on different surfaces. On paper and tissue, they said that it can only survive for 3 hours. On copper, 4 hours. On cardboards, be it cardboard boxes or cardboard papers, it can last up to 24 hours. On wood, the virus can actually live for 2 days. On pieces of cloth, all right, 2 days. Stainless steel, 2 to 3 days. All right, polyplastics, 3 days. Glass, 4 days. All right, paper money, all right, monies that we actually send around, the currencies, it can last up to 4 days. Then outside the surgical mask, they say that the lifespan of COVID-19 could be as much as 7 days. Hearing this, it's really scary, especially for those who actually use surgical masks. That's why they always encourage people not to recycle surgical masks, not to reuse surgical masks. Surgical masks should be a one-time thing. After the use, it should be disposed. But of course, with the fact that there is the shortage of supply and the fact that the insistence on some of the guidelines and places like the UK and some other countries that have insisted that people must wear masks, certainly we'll see people reusing this thing, but they stand the risk of actually carrying the virus for another 7 days on that particular mask, if not properly disposed.
Well, I think what is important here, in my view, is a statement by the WHO Director General that countries must stay alert and individuals must also take personal responsibility because of the possibility of a resurgence, which we have seen in China, in Beijing, in Xinfadi. They've, in fact, in the last 48 hours had to adopt more measures because more, persons have been infected in the southern part of Beijing. And then in Pakistan has reported a resurgence in about 20 cities. And then New Zealand, which we've been identifying as a good example of leadership, has reported 2 cases. And, Jacinta Ardern, the Prime Minister, has had to say, well, although they have declared New Zealand virus-free, but they always knew that, conquering the virus is not a specific point in time, that it's something that could be long drawn out. And the information you have brought about how the virus survives on surfaces, I think is very useful. And I hope that, the relevant agencies of government, particularly in Nigeria, will throw that into part of the communication process. Because part of the reasons for the success in New Zealand was the clear messaging approach by the authorities in that particular country. But clearly, what is obvious is that COVID-19 may be drawn out for quite a much longer time than we imagine.
Aaron, I believe you were going to tell us that New Zealand story.
Yeah, the New Zealand story is really confusing to me. Understanding on one hand, New Zealand had been very, very stringent about how things have actually played out in terms of handling of COVID-19. But they said that the new infections we're talking about right now, or the one doctor was referring to, actually came from 2 women who actually came from the UK. And we actually heard that they were quarantined when they came in to New Zealand, but they were allowed to leave from Auckland to Wimbledon, where they went to meet a family member, and they were released from quarantine on compassionate grounds. And they felt, okay, I think they wanted to go and see their mother. They were sisters. They wanted to go and see their mother. And they traveled from Auckland to Wimbledon and ended up infecting the person they went to see there. And right now, New Zealand already are beginning to have cases again. Of course, Jacinta Ardern said that it was always expected, but nevertheless, they will still do everything possible to curtail this. Really, really sad.
I want to interrogate that story even more. Did they take the necessary precautions? Did they cover up with face masks? You see, because I'm asking that question, Because when I saw that, even outside the face mask, it can stay 7 days.
Yeah.
I'm shocked, and I don't think I understand that properly. Are you saying that if I wear the face mask, I talk, or I pull the face mask and I say words, and I have the virus, it's going to stay in the air for 7 days?
Not in the air, but on the surface.
Mask.
Yeah,
on the
surface.
mask.
Yes,
on the
outside of the mask.
On the outside of the mask.
Which is why you can't wear a mask, take it off, then the next day put it back on.
So you have to disinfect and wash and
always
everything.
do that.
So that's why it's even more advisable, correct me if I'm wrong, to get the face masks that are homemade that you can wash and iron afterwards and use again.
But the question, or just throw away the surgical mask, wear it once and bin it.
And bin it.
Well, the question is this. People who actually have homemade masks have the tendency and probably the habit of just dumping it, picking it up when they want to go out again and just wearing it, because most of them, I don't know if people have a myriad of masks lying around. Most people just have maybe 1, 2, or 3 and they just pick it up. But if you do not disinfect this mask after every use, then you stand the risk of actually infecting other people or carrying it yourself. So,
but to go back to New Zealand, I don't really understand this relaxing of quarantine on compassionate grounds. What on earth does that mean? It's only essential services, correct me if I'm wrong, during the lockdown they were allowed to move around. Whatever has befallen you, a funeral or whatever, you do it like everybody else in the world is doing it. You have some kind of a virtual meeting. It doesn't make any sense.
Maybe they were complacent and they felt they had to handle the virus.
Well, Aaron, I thought the point about the 2 infections was that this was imported. From the UK.
It was imported into the UK and they were quarantined, but they now were allowed, these 2 women were allowed to leave.
It's those compassionate grounds.
We need to go and we can have the argument about essential services.
Thank you.